Sleep is the period when the body rests from the past day and prepares for vigorous activity. During sleep, various biologically active substances are synthesized, and our brains lock in all the new things we learned during the day. The quality of sleep can be significantly impacted by the position a person falls asleep in. While body position does change throughout the night, people tend to remain in the initial position for a substantial portion of their sleep. Sleeping on your back is perfectly fine for young kids, but for grown-ups, it can sometimes cause problems. Positive qualities of this body position during sleep include the unloading of the spine, uniform distribution of vertebrae around their own axis, and an even position of the spinal column. It also improves blood flow from the brain, reducing the intensity of headaches, facilitates nasal breathing, reduces the formation of secretions in the nasal cavity and sinuses, and reduces the likelihood of folds, swelling, wrinkles, and irritation on the face. You should not sleep on your back if there is a possibility of developing sleep apnea. If you have problems in the passage of air through the bronchi, difficulty breathing, episodes of bronchial asthma, increased intracranial pressure, or issues with the pharyngeal mucosa resulting from an acute or chronic inflammatory process. When you sleep on your back, your tongue and throat can relax and partially block your airway. This can worsen snoring and even cause sleep apnea for some people. Sleeping on your back can also worsen acid reflux. In this position, your stomach acid rests at the same level as your esophagus, making it easier to flow back up and irritate the lining. Sleeping on your back is also not recommended during pregnancy, as an enlarged uterus puts pressure on the spine, impairs blood flow through the inferior vena cava, and increases pressure on the digestive and urinary organs, resulting in dizziness, swelling, and constipation. For people with knee osteoarthritis, doctors often recommend sleeping on the back. This position can help reduce knee pain intensity and promote quicker sleep onset. If there are problems in the lumbar spine, lying on your back with a pillow under your lower back will quickly improve your health. For women, this position can help maintain breast elasticity, as the mammary glands do not sag but are supported naturally. If you sleep on your stomach, it's not always beneficial. Although many are accustomed to falling asleep in this position, lying on your stomach straightens the intervertebral discs, increases the intensity of blood flow to the kidneys due to relaxation of the body, and some blood vessels, which increase blood flow throughout your body, including the kidneys, which helps cleanse the body of toxins. It can also help reduce severe snoring and the threat of respiratory arrest. However, sleeping on your stomach may cause several unpleasant sensations, including an accelerated heartbeat since the lungs do not fully open, frequent urges to urinate due to increased pressure on the bladder, severe morning swelling of the face and neck due to lymph stagnation, morning headaches from deteriorated blood supply to the brain, and back and neck pain from muscle tension. Sleeping on your stomach is not recommended if you have insufficient blood supply to the brain, heart, and lung problems, cysts in the mammary glands, or are a woman during lactation, as it can worsen milk production. Additionally, frequent pressure on the reproductive organs can worsen their function, and digestion may be disrupted, increasing the risk of acute gastritis or ulcers. Sleeping on your stomach can also exacerbate symptoms of glaucoma, as persistently increased intraocular pressure can lead to a sharp deterioration in vision. If you sleep on your right side, it is worth noting that ancient Chinese beliefs suggested this position to allow the nervous system to relax. However, modern doctors believe that lying on the right side makes the heart work harder because the aorta bends to the left, which means the heart has to work under high load. The position on the right side is also not very suitable for the digestive organs, as the stomach presses on the pancreas, preventing it from working properly, and gastric juice partially enters the esophagus, leading to morning discomfort and heartburn. Sleeping on the right side is not recommended for people suffering from gastrointestinal diseases, especially those with GERD, those who have had a recent attack of cardiac arrhythmia or angina pectoris, and in cases of severe intoxication, as the outflow of lymph is obstructed. Sleeping on the left side is considered the most correct body position during sleep. It virtually eliminates the possibility of developing heartburn as the stomach is below the esophagus, making the reflux of acid into the esophagus unlikely. The digestive organs are in their normal position, not putting pressure on each other, so their work is not disturbed, and the movement of the food bolus occurs naturally. There is no risk of sudden respiratory arrest because the respiratory organs are in the correct position, reducing snoring. Cleansing the body is simplified as the movement of lymph improves, with thoracic lymphatic duct being on the left, making the removal of toxins more intense. The left side is also best for pregnant mothers, as it increases the amount of blood and nutrients that reach the placenta and your baby. The common belief that you should not sleep on your left side if you have heart problems is not confirmed by scientists and doctors. According to cardiologists, it is impossible to harm the heart by lying on your left side, as it is well protected in the chest. Heart health is not dependent on which side a person sleeps on, but rather on factors such as poor nutrition, excessive salt intake, insufficient physical activity, obesity, and frequent stressful situations. If you have no health problems, you don't need to worry much about your sleeping position, but it's still beneficial to try sleeping on your left side, as this is considered the most optimal and physiological position for internal organs. When sleeping, it is more important to ensure that your mattress and pillow are comfortable. For the health of the spine, and therefore the whole body, it is crucial to rest on an orthopedic mattress and use an orthopedic pillow.